Welcome everybody to another episode of our Ashtanga webinar series. We are very happy to continue this process of providing information regarding various diseases as well as methodologies in treatment and some take-home points through Ayurveda for our viewers. We have patients as well as doctors who come here regularly for our webinar program. Very thankful to all of you to help us make this program a success, a grand success to be exact actually. Thank you all. With that, I would like to start the program. With that, I would want to ask our Executive Director, Mr. K.S.Varier, to give a small introduction on behalf of K.S.Varier Ashtanga Ayurvedics Private Limited.
Very happy evening to all of you present here. So Ashtanga Ayurvedics, I'm proud and privileged to introduce my company, K.S.Varier Ashtanga Ayurvedics Private Limited, as it is called fully. K.S.Varier is a founder, so we named the company as the founder's name also. So K.S.Varier founded this institution in 1936. It has been 86 years since the company has been running. The company was founded with the backing of Kottakkal Ayurvedashala's founder, K.S.Varier, who backed our founder, K.S.Varier, who was a student of K.S.Varier. Later on, it is history. We have been, in the last 86 years, we have been producing 300 odd products in our company, in our factory. We are clinicians, we have clinics in Trichy. And our doctors also visit other places like Tanjavur, Kumbakonam, Chennai, Coimbatore, Bengaluru, and other places. So we are spread over. Our medicines go to Karnataka, Kerala, part of Andhra Pradesh, Maharashtra, as well as other places other than Tiruchirappalli or Tamil Nadu, entire of Tamil Nadu. So we market our products that way. We have about 200 and odd products in the classical line and the rest in the proprietary line as well as foods line. So K.S.Varier founded this in 1936 and he ran the company till 1988, after which he took a retirement. 1990 he passed away due to a surgical complication that he had, and after that it has been his sons who have kept the promise and lived up to the expectations. And today K.S.Varier Ashtanga employs about 80 people, and we are spread over all of south of Tamil Nadu. Sorry, all of south of India. So that's for the short introduction about Ashtanga. Over to Dr. Girish for furthering the program.
Thank you, sir. Thank you so much for that introduction. Today we have a topic which has been repeated in our webinar series because of its popularity. People are curious about this topic. So polycystic ovarian disease or syndrome, Ayurvedic approach to PCOS is what we have as a topic today. So PCOS is a health problem caused by an imbalance of reproductive hormones affecting 1 in 10 women of childbearing age. The general health and appearance of a woman with PCOS may be impacted by the hormones imbalance as well as metabolism issues. PCOS is also a common and treatable cause of infertility and one of the main causes of subfertility in women. We have chosen this topic for the second time, knowing its importance and the need for spreading awareness among the common on how Ayurveda helps manage PCOS. We have a great speaker here. Our guest speaker, Dr. Aswini Mohan L is an M.S. YIC, that is Associate Professor in Department of Prasuti, Tantra, Streeroga, Ramakrishna Ayurveda College, Medical College, Yelahanka, Bengaluru, and Consultant in Prasuti and Streeroga in I.A.M. Healthcare Center, Yelahanka, Bengaluru. Dr. Aswini Mohan L has more than 12 years of clinical experience. She has an MS in Prasuti Tantra Streeroga from Govt.Ayurveda College, Thiruvananthapuram. She is currently working as an associate professor in the Department of Prasuti Tantra Streeroga at Ramakrishna Ayurvedic Medical College, Yelahanka, Bengaluru, and as a consultant in Prasuti Streeroga at IAM Healthcare Center, Yelahanka, Bengaluru. Dr. Aswini Mohan has rich clinical experience in Ayurvedic gynecology and obstetrics, having practiced in Kerala and Bengaluru. Her special focus is on infertility and gynecological disorders. She has successfully treated many cases of infertility. She is also expertised in Ayurvedic preconceptional care, antenatal care, and postnatal care. She has treated many patients with endometriosis, PCOS, uterine fibroids, etc., and has improved the quality of life of many through conservative management. Dr. Aswini Mohan has a keen interest in academics as well as clinical aspects of Prasuti Streeroga and has provided trainings for doctors and conducted public awareness classes on radio and online platforms. She has also published several research articles in journals such as Comparative Study on the Effect of Trifala Gugulu and Rasaka Yoni Pratisarana with that of Trifala Gugulu and Tankana Yoni Pratisarana in human papilloma virus infection. In treatise, Journal of Ayurveda Medical Association of India, Ayurvedic Management for Intrauterine Growth Restriction, a case report, International Journal of Ayurveda and Pharma Research, and many more. I would also like to add that I have been fortunate enough to be to have worked as Dr. Ashwini's colleague as well in IAM when we worked together. We've had a lot of common cases where we have got quite some very good results as well as many things to discuss with each other. Dr. Ashwini has always been part of my personal advisory committee when I get patients of PCOS and as well as Prasuti Streeroga cases in general. Thank you, Dr. Ashwini, for being present here, for taking your time to give us a talk. Before I hand over the mic to Dr. Ashwini, I would like to ask everybody that any questions that you may have, please, you can put it in the chat box. So at the end of the session, we can go to the question and answer session where I would be reading out the questions and ma'am would be answering them. And at the end, maybe if there is enough time, we can also ask people to directly ask questions as well if you have any, if you want to interact with Dr. Ashwini as well. Thank you everybody for being present here. We would be sharing the link for the feedback for today's webinar by the end of this webinar, and for certificates you have to complete the filling of the feedback form as well. Thank you all. Thank you again, Dr. Ashwini, for being present here and giving us your time. Over to you, ma'am.
Thank you, Dr. Girish, for the wonderful introduction. Before starting, I would like to thank the management of K.S.Varier Ashtanga Ayurvedics Private Limited for giving me an opportunity to talk about such a relevant topic, especially to the Executive Director, T.R. K.S.Varier, MD, Dr. T.V.S. K.S.Varier, Medical Superintendent Dr. T.V.N. Varier, Dr. Shyam, and last but not the least, Dr. K.S.Varier for inviting me to this webinar. So without further delay, I'll go into my presentation. I hope my screen is visible.
Yes, ma'am.
Hello. Yes, and
yes,
audio is clear, I suppose.
Yes, yes.
Okay, so today, okay, thank you so much. So today my topic of presentation is Ayurvedic approach to polycystic ovarian syndrome. So Dr. Girish has given you a brief introduction regarding the condition. So I'll go in detail regarding that. So polycystic ovarian syndrome is a very common hormonal disorder which we see in reproductive aged females. And he has already said like it is seen in 1 in 10 women. It has become so common that every one female among 10 females we see this condition, and it is associated with a lot of complications also. So how do you know that you have polycystic ovarian syndrome? So like it has become so common that now we see that even in adolescent age group, that is 16 years, 17 years, even from that age we see this condition. So how we diagnose it is based on a criteria called as Rotterdam criteria. So first thing is like your cycle regularity. So see, a menstrual cycle is considered normal if it comes within a span of 21 to 35 days. So the first thing that may happen is a delay in the cycles, which means if your cycles are getting delayed by more than 35 days, and it can go up to 2 months or sometimes 3 months, and rarely like, up to 6 months or 9 months, some females do not get their cycles. So that is one thing. So irregular menstrual cycles is the first thing that we see in this condition. So usually there can be less than 9 cycles per year also, which means like you'll be getting cycles once in 2 months like that. And as I said, in very severe cases of polycystic ovarian syndrome, what we see is the cycles may come once in 3 months or even 6 months or even 9 months. And they will get normal cycles only if they go for some hormone treatments. So irregularity in cycle is a symptom which you need not ignore, because it may indicate some underlying pathology. See, another thing is hyperandrogenism. So how we understand is that there are females who get unwanted hair growths. For example, facial hair growth. It can be upper lip hair growth or hair growth on the chin, or like, on some other parts of the body in a male pattern. It will be like very thick, coarse hair growth will be there. And that is like, it is called as hirsutism. So unwanted hair growth is one thing. Another thing is like you can have lot of acne, lot of pimples can come. So suddenly, like, there may be weight gain associated with some irregular cycles, and there may be appearance of lot of acne, hair growth. So all these features also indicate there is a hormone imbalance, and it may point towards polycystic ovarian syndrome. So this is how we clinically assess. Means by seeing a patient, if they come to us telling that I have unwanted hair growth, my upper lip hair is growing, or my chin hair growth is more. So that complaint, if they're telling us, and if they say that my pimples are increasing rapidly, so all those, if they say, it points to a condition of hyperandrogenism where the male hormones in the body are increasing. So that is one feature of polycystic ovaries. And how we can evaluate that by some laboratory test is by assessing testosterone levels and all that. But generally those tests are expensive. So clinically itself, we can analyze whether this hyperandrogenism is present or not. So various hormone tests like testosterone, DHEAS, some tests are there, which are very expensive since it's hormone based test. And another thing is like many, as a first line of investigation itself, they go for ultrasound scanning, because nowadays investigations have become very common, isn't it? So even like, a 15-year-old or 16-year-old, generally they come to us with a scan report, which will usually say polycystic pattern of ovaries or polycystic ovarian syndrome. So the scan report will say there'll be like multiple follicles in the ovaries. So how we conclude that it is polycystic ovaries is that, see, it is not mandatory to have a scan report actually. So there are three basic criteria. One is irregularity in cycle. Second thing is like if you have unwanted hair growth in your body, or it can be hair loss also. For example, scalp hair loss will be there, and but upper lip and other areas hair growth will be more, and more of acne. So if you see any of these two criteria also, we consider it as PCO and treat. Because see, in adolescent age group, actually the scanning, with the scan report itself, we cannot say that it is polycystic ovaries. Suppose the scanning is saying polycystic ovaries, and if she doesn't have any features of hyperandrogenism or the cycles are regular, then it is not considered as PCOS in adolescent group. Because in adolescent, it is common that the ovaries can be slightly bulky. Okay, so the scan report may show increased number of follicles, and it can show increase in size. The volume of the ovaries can be more in scan reports. So this is how you get to know whether somebody is having PCOS or not. First thing to keep in mind is irregular cycle. Second thing is like whether any features of excessive male hormones in the body is there or not, which is evidenced by unwanted hair growths in face or any part of the body. And of course, in investigations, if you are going for polycystic ovary. So if any of these two criteria are fulfilled only, it is considered as polycystic ovarian syndrome. So this is just an image where you can see the normal ovaries, okay, and the polycystic ovaries. So there will be multiple cysts which can be seen, and the size or the volume will be increased. So why this happens is basically because the ovulation is not happening. So every month, if you are having a regular cycle, the egg should grow and it should get released. So if that process of ovulation is not happening, if the egg is not growing properly, and if it is not getting ovulated, then you tend to develop these small size cyst. So this is another image, like, which we see in ultrasound scanning, where on the left side, you can see these are the normal ovaries. And this image shows that there are multiple cysts, and it will give a necklace pattern. Okay, there can be more than 12 or up to 25 small cysts which will be seen. So hyperandrogenism, as I said, because it happens as a result of more of male hormones in the body. So as I said, like, it is because of, it can be presented as hirsutism, where you get coarse, dark hairs distributed in a male pattern. And scalp hair loss. Where you need hair, it is not there. So for example, you lose hair on your scalp, on your vertex, crown, diffusely, you may lose hair. So these are just some images where you can see hirsutism. See, and another condition is there, which is called as acanthosis nigricans. Means there can be a blackish discoloration around the neck, or it can be there in the underarm area. So in few areas, you may see these kind of changes also. So many times, like those who come to us with polycystic ovaries, they may have excessive weight gain. But there are people who have polycystic pattern, irregular cycles, all that, even with a normal weight, normal body mass index they'll be having. But still, they may also present with complaints of irregular cycles and polycystic pattern of ovaries. So different presentations can be seen. It's not mandatory that weight gain is associated with PCOS, or that PCOS will not come in those who are lean, because we see lean PCO as well as obese PCO. See, and PCO is not just limited to the menstrual cycle. It has long-term implications. So even though we say that it is very common, it is like 1 in 10, and so it's fine. So actually, it's a very dangerous condition also if it is not treated at the proper time. Because as I said, it prevents ovulation. The egg release is not happening in polycystic ovaries. So once that is not happening, you will not get your cycles on time. And like you may skip cycles for say like 2 months, 3 months, or even more sometimes. And once the bleeding comes, the pattern can vary. So once you get the period, sometimes the bleeding can be scanty. So even after having no cycles for around 3 months, 6 months, for some females, what we see is the bleeding pattern will be less. But in some others, what will happen is they'll have heavy cycles. They're not getting cycles for some time, but once they get the periods, they have heavy bleeding, and it may last for a month or maybe even more in some cases. That is because the endometrium thickness keeps building up. So you may bleed for a longer duration of time, which will ultimately lead to hemoglobin levels which becomes low in your body. So it results in anemia and its complications. And since ovulation is not happening, polycystic ovaries is one of the most common causes for infertility. So it is an ovulatory factor of infertility. So in reproductive age group, if polycystic ovaries are present, there can be infertility. And as Dr. Girish had already said, it is one of the most correctable causes. Ovulatory infertility and ovulatory infertility is considered as one of the easiest cause to correct. And among that, polycystic ovaries has got a very good management with Ayurveda, because most of them, they are able to conceive after taking Ayurvedic treatments. Another thing, like what I said, is like obesity can be associated. So another long-term complication is like there can be a chance for diabetes. So in those who have polycystic ovaries, there can be a chance of developing diabetes, and you know that diabetes comes with its own share of other complications. So that's why clearing polycystic ovaries at a very early stage is very, very important. You cannot just neglect that, it's very common, so it is fine to live with PCOS. No, you have to clear it in the initial stages itself, so that it does not go into complications like where you have diabetes at a very young age. And another thing is like they have higher risk of developing cardiac diseases, and they may have depression. Higher chances of depression is there, and they may have sleep disturbances. And another long-term complications which we need to be very careful about is endometrial cancer. Actually, nobody has an idea that polycystic ovaries is a cause of some kind of cancer, but it is. Because we said, like, if you're not getting your periods, what will happen is the endometrium will go on increasing in size. And ultimately, what will happen is, if that tendency continues for a long period of time, it results in endometrial cancer. And that can be, very detrimental to the patient. So that is why treat this polycystic ovaries at a very initial stage itself, so that it doesn't give you long-term complications like type 2 diabetes mellitus at a very young age, and even endometrial cancers if it is not properly managed. And what we have seen is like, see, most of the people who come to us with polycystic ovarian syndrome, in a scan finding, they will also have hepatomegaly. So they are more prone to hepatic diseases or liver diseases. So that's why, like, once you identify that there is an irregularity in the period, don't tend to ignore it. Because what happens is many females, they are like, okay, irregularity in cycle, it may be there for some people, maybe I should wait. But it's not like that. If you have irregularity in cycle, and if you have these unwanted hair growth and acne and some polycystic findings in your ovaries, you should immediately start treating it, or taking care, take some steps towards correcting it, so that you can stay healthy for a longer time. So this is just an image which shows the symptom complex. It's called as a syndrome because it affects a lot of systems. So like excessive body hair growth we have already discussed, and weight changes. Okay, means like they may be doing rigorous exercises, but still they may not be able to lose weight. So that is one thing which people come to us with. They would say like, I've been dieting, I've been doing regular exercise, rigorous exercise, but I'm not able to lose even like 1 kg of weight. So that is another problem. And there'll be cyst and irregular cycles, male pattern baldness, insulin resistance. So insulin resistance, as I said, like gradually it leads to diabetes. And what happens is, we said like PCOS leads to infertility in many cases. And what we have seen is, in those who have polycystic ovaries, even when they conceive also, they have a higher chances of abortion. Once they conceive also, like they may have higher chances of abortion, and also they may have a tendency to develop diabetes and hypertension in pregnancy. So even though, like it is something which starts at an early stage of life, it keeps you haunting throughout your life if it's not addressed properly at the right time. So like and another thing, like now we need to see why this is so common. We said it is common as like 1 in 10 women, but why? So it is said that there is a genetic predisposition for this condition, along with some environmental factors. See, that is the catch there, because you may have genetic predisposition to many conditions, but it does not happen in everyone, isn't it? So there are definitely some things that you do, or some external or environmental factors, which will lead to the manifestation of the disease. So why I want to stress this point is that, see, Ayurveda is a science of prevention also. So you cannot change your genetic predisposition, isn't it? Like if you have it in your genes, it is there. But what you can alter is the environmental factors, or like how you can modify those things so that you don't get that condition. So genetic predisposition is there. And if along with that some irregular diet habits, improper regimens and all, if you follow, then you have a higher chance. So whenever somebody comes to us with polycystic ovarian syndrome, generally we ask, is there anybody in family who has irregular cycles? Any of your sisters, any of your close relatives or mother, like that we ask. So that is why genetic predisposition is there. And those who are obese, they definitely have a tendency to have these polycystic ovaries. So the risk factor is, as I said, like first degree relatives with polycystic ovaries, like mothers, sisters, and all that. And prepubertal obesity. See, this is a very important thing that we need to note, because nowadays we know that, see, earlier it used to be malnourishment, isn't it? Like in childhood, in adolescent age group and all, it used to be malnourishment. Even now it is there in few areas. But still what we see nowadays is prepubertal obesity. Like 10 to 19 years, we say it is as an adolescent age group, 10 to 19. So what we see is many females, many children in these age group, they have obesity at that very young age, and that is very dangerous. And that happens mostly because they don't even realize what is healthy, what is unhealthy. Even their parents, they seem to be unaware as to what is healthy and what is unhealthy. So prepubertal obesity is a very important risk factor. And see, and there is a concept in Ayurveda that how you are in your womb, in the sense like during the pregnancy period itself, many things are determined. Okay, so that's why Ayurveda gives a lot of importance for pregnancy care, or Garbhini Paricharia. So what a mother takes in her pregnancy, that is also very important. So interestingly, in modern also, above average or low birth weight is considered as a risk factor for PCOS. So you can see it is not something which is happening all of a sudden. It has a long process, long years of process wherein the disease manifests. So that's why even like we have to focus when a female is pregnant also, to prevent these kind of things which we are like quite unaware of. And another thing is like premature adrenarche, which means like nowadays we see that the age of menarche, the first time that a girl gets periods, it has come down. Earlier, it used to be like 13 years or 14 years, something like that. Now we see like a 10-year-old, 11-year-old females achieving menses. So if they have a tendency to develop pubic hair at a very young age, so usually pubic hair development and all happens a few years prior to the onset of menstruation. So if that is happening early, then also it is considered as a risk factor. And of course, some drugs, some anti-epileptic drugs also have a chance of developing polycystic ovaries. So I told like there is a genetic predisposition, along with that some environmental factors. So you see, and one important thing is epigenetic mechanism. So epigenetics and Ayurveda, actually it's a very interesting topic. See, epigenetics is actually what happens is there will be no change in the DNA sequence. You already have a genetic predisposition, but these environmental factors, it doesn't change the DNA sequence. But your diet, your lifestyle, your environmental factors, all that has a impact which will lead to inheritable alterations in the genome, which means like if your diet and lifestyle is not proper, you may transmit it to the for the future generations also. And we all are aware of various environmental toxicants. I'll just mention a few. See, like for example, plastic containers, okay, BPA. So it is considered as a endocrine disrupting chemical. So it will create havoc in the normal endocrine balance in the body actually. So it will like many people don't realize, for small children itself, they give food in some plastic containers which is not of good quality, or some toys which they play with, they usually tend to keep in mouth. So all those are basically toxicants which can disrupt the hormonal balance. So all these seem to be very simple things, but all are very important. It can cause a lot of health problems in future. And see, physical and emotional stress, that is also very very important. It is not, you see, any disease, stress plays a major role, and Ayurveda gives much importance to this, because what we say is that the relationship between mind and body, it is like a hot pan and ghee. Okay, if you put oil on a hot pan, it will melt, right? So same way, if you have emotional stress, if you have a lot of stress in your life, it will definitely affect your body also. Okay, so what the modern studies have found out is also nothing different. What it has found out is that physical and emotional stress makes a chronic inflammatory condition in the body, and it also causes insulin resistance, means a lot of stress leads to diabetes also in future. So thereby it is also a risk factor for polycystic ovaries. And diet, see, excessive fatty food, saturated fatty acids intake, like nowadays like everyone likes to take outside food, especially children. So they start taking this from a very young age. They like to take pizzas, or they like to take some shawarmas, which is all like very high in saturated fatty acids. And everybody is indoors mostly, especially because of this last 2 years of COVID. People started being indoors most of the time. So exposure to sunlight, that is also very very important. And so vitamin D deficiency is also another thing which may lead to polycystic ovaries. So in allopathy, actually the management, what they say is, one thing is everywhere, be it alternative medicine or modern medicine, what they suggest is lifestyle modification. So first thing they would suggest is like weight loss. You focus on weight loss. So at least 5% of the fat should come down. So that is a general lifestyle modification which is advised. And in modern, actually, other than the weight loss suggestions that they give, how they manage is, one thing is their aim is actually to get the periods every month. You're not ovulating, you're not getting your periods. So induce the cycles, get your periods. But that is done with hormonal contraceptives, okay, oral contraceptive pills. So what we see is like many young girls, they come to us after stopping this oral contraceptive pills because of the side effects. They can have a lot of bloating, they can have weight gain because of the pills. So all these complications are associated with this hormonal contraceptives. And you should also remember that these contraceptives are taken by somebody who is like very young. Even in the adolescent age, they prescribe this medicine because that is the only line of management. And the interesting fact is, this hormonal contraceptive, it does not induce ovulation. It is not correcting the problem of ovulation. Okay, we said ovulation doesn't happen, so these contraceptives just make the cycles artificially, but the ovulation is not corrected. Another thing is, we said there is insulin resistance, chance for diabetes, and so they give anti-diabetic medications. Metformin usually is given. So even though See, many studies say that metformin or antidiabetic medications will help. Actually, it does not help in the long run. It does not prevent the long-term complications, as I said, of endometrial cancer and cardiovascular risk and all that. Another thing is, like, if they are in the reproductive age group, suppose they are suffering from infertility. So what they give us, like, artificial methods to conceive. So they give lot of ovulation induction drugs, medicines, and even sometimes, they go for artificial ARTI, artificial reproductive techniques like IUI, and in severe cases like IVF. So all those comes with its own share of complications. So especially in infertility patients, when they come to us, they come with a lot of distress, like physical distress as well as emotional distress, because the treatments are very expensive. And because of the hormone treatments that they take, they develop a lot of other problems also. So but correcting ovulation is the aim in Ayurveda. So now let us see what is the Ayurvedic aspect. So Ayurveda focus on preventive as well as curative aspect. So as I said, like, we said among the risk factors that low birth weight and high birth weight for the gestational age is a risk factor, which means that when the child is within the womb itself, you should start the preventive aspects. So that is why Garbhini Pericharia is very, very important. And another thing is, so see, those are some factors we said about this epigenetic factors, isn't it? So some things which we can modify without changing the DNA sequence. So that happens in the Garbhini Pericharia when the mother is following a healthy diet and lifestyle. Another thing is, see, when a female attains menarche or when she gets a first cycle, traditionally there were a lot of things which we used to do. For example, we used to give sesame oil for those who attained menarche, or and there are some home remedies which they used to give. For example, some porridges, rice porridges with jaggery, all those things which used to be given earlier. Now we have lost that. We have lost that tradition of all these things, and nowadays even children are not willing to take all these things. But see, the menarche regimen that you do, that will help in long term reproductive health. That will ensure that your cycles are proper till the time you have your periods, till you attain menopause. So that is the importance of menarche regimen. So if you start it right, it is best. So menarche regimens should be followed properly, like giving of sesame oil internally and the rice porridge. Just actually the traditional system, it varies with each region, and whatever the regional traditional practices are there, that should be followed properly in the menarche time itself. Because usually what happens is, once a female attains menarche, initially they say 2 to 3 years or up to 2 years, it can be irregular cycles because the ovulation is not happening properly. But after that, it should regularize. But the thing is, see, there are many children who have proper cycles from the time they attain menarche. They may not have any complications. But nowadays, what we mostly see is they may have heavy bleeding. Okay, late cycles associated with heavy bleeding, which results in adolescent anemia. And we know that in a country like India, anemia is like a very important problem, very important health issue. So once we follow these menarche regimens properly, we can, actually arrest all these problems at a very initial stage itself. So next is something which is very uniquely said in Ayurveda. It is called as Rajaswala Pericharia. Okay, Rajaswala Pericharia means what you do during your cycles. That is also very, very important. See, it's a physiological process, agreed, but there are certain things that you need to take care in your diet and in your regimen during the period of during your time of cycles. Okay, nowadays we see a lot of advertisements where, it's seen that, they play basketball or football, a lot of things. But what Ayurveda advises is, during your cycles, you should be avoiding strenuous physical activities. You can do your normal activities, but not something which is like physically very strenuous. Because what happens, like in a normal menstrual cycle, what happens is the bleeding happens in a downward direction, isn't it? The blood flows out through the vagina. But if you are undergoing like rigorous physical exercises, what can happen is the blood can flow in the backward direction, in the reverse direction. And in females, actually the tubes are open, so it can spill into the abdomen, and that can lead to various other complications. So rigorous physical activity during cycles is not advisable as per Ayurveda. It should not be done. Normal activities can be performed. And your diet, what you eat during your menstruation, that is also very, very important. Because see, if you are taking something very heavy on digestion, then that will cause problems with your cycles in the long run, because your general metabolism is on the lower side during your cycles. So there are specific diets which are mentioned in Ayurveda, which needs to be taken during cycles. For example, it should be something which is cooked in red rice mixed with milk, little ghee. So it should be light, nutritious, and easily digestible. It should not be something which is very heavy, which is like junk food. So Rajaswala Perigeria is something very important. That is what you do in each cycle. You have, like, so many number of cycles from the time you get your periods till your menopause. You have so many number of cycles happening. So during those days, what you eat and what your regimens are, that plays a very important role. See, these are just few things which I wanted to share with you, which I've already discussed. One is the Manak regimen, like where sesame oil, sesame seeds, like tilladus, elunde and all were given traditionally. So whatever the traditional practice has been in that particular region, that should be followed during the time of Manak itself. And there traditionally, like there used to be this Ashoga kuruk. Ashoga flower used to be made like a porridge with rice flour and palm jaggery during cycles, and that used to be given. So that will prevent the heavy cycles which we usually see in adolescent age group. And of course the rice porridge, which is cooked with milk. Red rice is preferable with milk, or even shashtiga rice is like very good. So that cooked with milk as well as with little ghee. Those are the kinds of diet that you should be taking. And see, Ayurveda considers each individual as unique. So we say the Prakriti is different for each individual. So in modern, like we said, like they treat in a common way. They treat it like, with oral contraceptive pills or anti-diabetic medicines, or if it's infertility, with infertility treatments. But the interesting thing is, like, it is not customized. It is not individualized treatment. It's a common protocol. But Ayurveda doesn't believe in that. Ayurveda believes that each person is different, each person has a different Prakriti. And Artava is considered as Agneya. That means your menstruation is considered as something which requires some heat element in your body. So Ayurveda focuses on maintaining that Agnayatva in the body so that your ovulation is corrected. We said even with oral contraceptive pills, the ovulation is not getting corrected. But once you take Ayurveda, what will happen is even the ovulation is established. See, it's not a hormone pill which induces medicine, but the ovulation is established by correcting the Agni in the body. So Agni is something which we consider as a basic metabolic fire in the body. So once that is corrected, then the cycles will become ovulatory, and naturally you will have regular cycles, and all the complications which arise as a result of polycystic ovaries also subside once you follow Ayurveda. So, and we also have a concept of tridoshas, sapta dhadus, and dhadumala. So doshas basically we consider as vata, pitta, and kapha, and the involvement of these doshas varies depending on each person. Because I said, like, we see patients who are obese and present with PCOS. At the same time, we see people who are very lean and still they have all the features of hirsutism, polycystic ovaries, even those kind of categories there. And the same protocol will not work for both these categories. So it needs to be different. And there are 7 dhadus in the body, which forms, the basis of your health. And excellence of this dhadus are also very important, which will be possible only through a proper diet and lifestyle. And one more thing is, like we said about this hirsutism, right? Unwanted hair growth on the face and all that. So that hair growth and all is considered as a dhadu mala in Ayurveda. For example, it is considered as a hirsutism or the hair growth. It's considered as a dhadu mala of asti dhadu. So we focus on correcting these basic pathologies. Okay, it is not just the induction of menstruation, but correct the base root cause so that your ovulation is corrected and you get relieved of the symptoms in a natural way. So see, some diet which we generally recommend in those who have polycystic ovaries, that is those who do not have proper ovulation, is one thing is sesame oil, which I've already told. Black sesame seeds, there are 2 varieties of sesame seeds, isn't it? Like black and the white. Black is considered very good. It is like a very rich source of a lot of micronutrients. It's a natural source of calcium. A lot of benefits are there, and it improves the quality of the egg. It helps in the growth of follicles and proper ovulation. Another thing is horse gram, kulthi, you call it as kulthi. So kulthi is also very good. And use of garlic in diet is also something which is helpful in having ovulation. And hingu, asafoetida, everyone will be using it in kitchen. And methi is also good. Using jaggery or palm jaggery instead of sugar, that is also very beneficial. So what you can see, all these are part of your diet itself. It's not like you don't have to consider it like a medicine. So make some changes in your diet so that naturally everything gets corrected without resorting to any hormone pills. And what you should be avoiding is excess of sweets. See, in Ayurveda, we generally say there are 6 rasas, shad rasas are there. So madhura rasa in excess or excessive sweets is not good to have a proper ovulation, because we said artha vaisa agneya, you need that heat element. So when you are taking excess of sweet things, what happens, it just subsides that agneyatva in your body, and you may have menstrual irregularities. And curd is also to be avoided. I know that curd is something which is like very staple for vegetarians, but there are some conditions like how you should take curd. For example, curd should be mixed with little bit of ghee, and in actually generally in those who suffer from polycystic ovaries, we restrict them on curd, but you can advise them buttermilk after removing the cream part. As buttermilk they can take. And poultry, chicken and eggs, we tell them to leave that habit of taking poultry, chicken and eggs, because we know the hazards of it. There are a lot of hormones injected to it, as well as it disturbs the hormonal balance in the body. Another thing is, see, there is a concept called as viruddha ahara in Ayurveda. So viruddha ahara is like, see, we all have a habit of taking these milkshakes, isn't it? So what happens in that is, see, there'll be different kind of fruits sometimes, and like milk, raw milk, which is like unboiled and frozen, that is there. So you're mixing up all these things. So actually it is like, contradictory in potency. So milk is something which is considered as cold in potency, whereas these sour fruits, it is not, it is like hot in potency, once it metabolizes. So there are a lot of things which are contradictory in potency, or it becomes contradictory when you cook it. So those kind of incompatible diet also should be avoided. For example, meat with curd. So we all have this biryani with curd, isn't it? Or raita we have with non-veg, but it's a viruddha, ahara. So sour fruits plus milk, just a few examples that I'm giving, which we all generally follow, but is not good for long-term health. So all these viruddha aharas also will cause problems, which will lead to various kinds of disease in the body. And there are 18 types of viruddhas which are said in Ayurveda. And interesting thing is, like, as a complication of viruddha, even infertility is said. And bija sambandha, the quality of your sperm and egg, is related to your satmya. Satmya means what you intake, what are you use, what is your diet habit. So generally when somebody comes to us, we spend a lot of time asking, okay, what do you take, when do you sleep, we ask a lot of questions. So that is to correct their lifestyle. See, if somebody is coming to you with irregular food habits, or like a bad diet habit and bad regimens, and if you keep on giving medicines, you'll not be able to correct it. Unless you correct the cause in them, the medicines may not help. So in regimen, it is like, when you eat, it should be hidabuk, midabuk, kalabuk. Means you should eat only which suits you, and eat in moderation. You should eat on time. See, so it's like, the simplest way that I can tell you, because if you skip your meals, some people have a tendency of skipping meals. They skip breakfast and go for work, or skip breakfast and go to school, because everyone is in a hurry. So what will happen in the long run is that can lead to hormonal imbalances, because we said like it is based on tridoshas. So it causes vata vitiation, it affects your pitta balance in the body, and it causes kabakshaya. So it causes all these menstrual irregularities. And you have to follow your dinacharya properly. Dinacharya means your daily routine, right from the time that you wake up, what all you do, that comes under dinacharya. So in that, like, oil application, daily oil application on body is said, moderate exercise is said. So all those things needs to be perfect. And there is something called as Ridhucharya. Means, see, we know that each season is different, isn't it? So there are certain kind of diet which you need to follow in each of the seasons, diet and regimens which you need to follow. So, and there is something called as Ritu Shodhana, means periodic detoxification of the body. So once you do all those properly, then also you can prevent all these conditions. And then there is something called as Sadvrita, where, like as I said, mind and body relationship is very, very important. So Sadvrita basically is a code of ethical conduct. So it's just not having junk food or following a healthy lifestyle is not just enough. You should have good thoughts also. Your mental health also should be good. You should have a positive outlook. You should not harm anybody. Like that, you should have a little bit of sattvic qualities as well. And in don'ts, like day sleep is something which is very common. People tend to sit late night watching movies or Netflix, all those things. Again, that vitiates vata, and it causes kabakshaya, and it causes irregular cycles. So sleep pattern, your sleep pattern is very, very important, not just in PCOS but in many other conditions also. So day sleep is to be avoided, late night sleep also is to be avoided. Seems like very simple things, but these can have long term health implications. And strenuous physical exercise, as I told you, especially during cycles, erratic food habits, and stress control, your stress levels, like at any cost, like, because there is no use. You said, we said, already said that stress induces a chronic inflammatory state in your body, and it also leads to insulin resistance and diabetes. So you have to find ways to manage your stress. So I think if you follow this Sadvrita, the Dinacharya, Ritucharya, all those, you will not be stressed. Another important thing is natural urges. Okay, so like school going children, all those, they have a or even office going people also, they tend to hold their natural urges. Like when they have the urge to pass motions, or when they have the urge to pass urine, they hold it. Or like when they feel like sneezing, they don't sneeze. So these are all natural urges which should not be withheld. And especially this holding of natural urges is a very important cause of gynecological disorders, because anterior to the uterus, in front of the uterus, there is urinary bladder. Just behind the uterus is the rectum, where the stool gets stored. So what happens is, if you keep holding this your urination urge and your motions urge, what happens is it causes a pressure, constant pressure on the uterus, and that leads to a lot of gynecological problems. For example, severe pain during menstruation. So when we ask people, what we notice is, like, those people generally have a tendency of holding the natural urges. So that is also to be avoided. And like, so how do we treat? So treatment in Ayurveda is like very interesting. It's not mandatory that every person with PCO needs a medicine. So what we say is like, tatra alpe lankhanam pathyam madhye lankhana bhajanam prabhude shodhanam. So means, if the patient, if somebody is coming to us at a very early stage, then we can suggest them only exercise, some very simple things, and some changes in lifestyle, or in their diet habits. With that, they may get corrected. But if suppose the disease has progressed to a little bit higher grade, then they may need some treatment also. Okay, lankhana and pajana, they may need some medicines as well. And suppose if it's like very severe, where they don't they have infertility issues, or the cycle irregularity has become so bad that they get only 2 cycles in a year, something like that, then they need something called as shodhana. So shodhana is another very important treatment aspect in Ayurveda, where we give panchakarma therapy. So basically, it clears, in a simple way, if I can tell, it clears the clogged channels in your body, and it provides proper nourishment to all the dhadus in the body. So Shodhana therapy is also done in very severe cases. So what you have to keep in mind is, if you are coming for Ayurveda treatment at a very early stage of the disease, you may not need any medicines at all. You may just get some diet and lifestyle changes. Suppose if it's little bit, more, then you may need some diet, lifestyle changes, plus you need medicines, internal medicines. Suppose you're coming to us at a very late stage of the disease, you may need treatments. So it's not mandatory that, every Ayurveda treatment requires medicines or treatments. So Shamana and Shodhana are the two types of treatment which I've already said. So Shamana means like we give internal medicines only. We give medicines and some advices to clear the problem at an initial stage. And Pancharma therapy is in advanced conditions of the disease. So see, what the Ayurvedic medicines aims at is ultimately maintaining the Agni. Okay, Agni is an important concept in Ayurveda. You can, in a simple way, what you can understand is Agni is a basic metabolism in the body at a cellular level, at a very subtle level. It's not just your digestion, but even at the level of each cell. So maintaining Agni is the most important thing. And we said about the 7 dhadus in the body, in that reproductive tissues also will come. So aiming at that. And once we do all this, once we aim at correcting that metabolism and ensuring the nourishment of the tissues, it automatically results in ovulation without resorting to any hormones, and naturally the fertility is maintained. So some treatments which are generally done in Ayurveda is, one thing is Udvartana. Another, Udvartana is basically a powder massage. Okay, so in simple term, if I can say, but it basically corrects your Agni. And then there is a treatment called as Sneha Pana. Okay, Sneha Pana, where we give some medicines internally. So it can be medicated oil or it can be medicated ghee. And then there is a treatment called as Vamana. Okay, Vamana is also something which stimulates your hypothalamo-pituitary ovarian axis. So if you have to have a normal cycle, there are a lot of hormones which are secreted from the brain. So Vamana is a treatment which will help in maintaining that endocrine balance also. So that is one treatment. Another one is Virejana. So Virejana also is a cleansing Panchakarma treatment. So depending on the constitution, we said the Prakriti is different. So depending on the Prakriti, we choose whether Vamana is required or Virejana is required or both are required. It's not necessary that all the treatments are required for everyone. As I said, it's customized. So it depends on the Prakriti. What etiological factor is happening in each person, it varies based on that. And then there is something called as Basti. Basti is a medicated enema, and so even that corrects the irregularities in cycle to a very great extent. And there is a special procedure called as Uttaravasti. So Uttaravasti is a Sthanika Chikitsa, means it's a local procedure which is done, and this is done only in cases where they desire fertility. So instead of going for artificial reproductive techniques, you can go for this Ayurvedic treatments like Uttaravasti, where the ovulation happens in a natural way, equality is improved, and even the uterus is prepared in a better way. So this is in brief regarding the treatments. So the advantages of Ayurveda is it's completely non-hormonal, natural herbal remedies, and as I said, it establishes ovulation, improves fertility, and it prevents all long-term complications. We said, like, it's just not the irregularity in cycle or infertility, but you tend to have cardiovascular disease, or you tend to have diabetes, or even endometrial cancer. So those long-term complications are prevented by following Ayurveda. So Ayurveda Amridana, Ayurveda is something which gives a proper treatment for almost all the conditions, especially for gynecological disorders. Ayurveda gives excellent results. So with this, I'm concluding my presentation. Thank you all.
Thank you so much, Doctor, for that wonderful presentation. I am sure that a lot of take-home points were taken by our viewers today. There are a few questions which have come up in the chat box. Shall we go on to the question answer session?
Yes, we can go.
Yes, Doctor. So 1 second. Yeah, the first question is, when acute or chronic stress is a causative factor, will resolving the stress alone cure the condition?
See, actually, stress is something which will, as I said, it will affect both the mind as well as the body. So yes, if stress is a major causative factor, we focus on relieving the stress, because we said, like, the medicines are customized. So what we see is, like, we'll be asking a lot of things to the person as to, just to understand what is causing the problem. So if we feel that stress is a factor or psychological factor is the main thing, actually we give medicines to correct that initially. Okay, so yes, if stress is a factor, correcting stress alone definitely can cure the condition if it's in a very initial stage. It depends on when they're coming to us. If they're coming to us at an early stage, and if you're able to make a diagnosis that yes, stress is an important factor in this particular person, then correcting that itself may correct the problem. That is possible.
Yes, Doctor. So before going on to the next question, The feedback link I will be putting in the chat box. Everybody can go into the feedback link, feedback form, and give your feedback for today. Feedback is compulsory for getting the certificates. This is the feedback link. Yes. So I have posted the feedback link for everybody. Next question is, allopaths use anti-diabetic drug like metformin for PCOS treatment. Can Ayurvedic medicines used for diabetes also help in PCOS? One of our products, Mehani, has been taken for a PhD study on PCOS and the paper has been published. How does it go practically? Can Mehani be used? This is a question from the executive director.
Okay, sure. See, actually, anti-diabetic medicines are like the metformin are given in allopathy. So see, there are different types of practices that we follow. So generally what in my practice, what I follow is like I focus on correcting this Agni concept, and ensuring ovulation. And yes, anti-diabetic medicines may have to be used in certain people. It may be required. For example, if they have this features of obesity, and I showed that blackish discoloration on the neck and all that. So if we see all that, it indicates that we call it as prameha in Ayurveda. So if there is a prameha samprapti in that particular patient of PCOS, definitely we give medicines to correct the samprapti of prameha. It is not like we are using it as an anti-diabetic medicine, but when we consider this polycystic ovaries, we consider different disease pathologies. So in the particular patient, if a prameha samprapti is present, we give medicines to do that correction, to alleviate that prameha samprapti. So then yeah, there definitely anti-diabetic medicines which are mentioned in Ayurveda or in our prameha context, or like the medicine that you had mentioned, which is being used by various doctors in studies and all that. Yes, that definitely comes into a play. That can be used, but it's not mandatory that every polycystic ovaries patient needs it. If it is associated with prameha samprapti, definitely we give medicines which are mentioned in that context.
Yes, doctor. Thank you. So the next question is curd with ghee. Can you elaborate?
See, actually, curd is something in Ayurveda which is said as, which can clog the channels. Curd is indicated in some conditions, but continuous use of curd, it is considered as abhishyandya, which will clog the srodhasas or channels in your body. So, so when you are using it with little bit of ghee, say there are a lot of other anupanas or a lot of other adjuvants which are said for use of curd. So one thing is, just one example that I gave was curd with a little bit of ghee. It can be used with moong dal also. It is said to be used with little honey also, very depending on the condition. So curd with little bit of ghee, if you are using, it will reduce the bad effects. But even then, actually, curd is restricted in polycystic ovaries.
Yes, ma'am. So the next question is, okay, there is a comment from our MD, very informative session. Discipline lifestyle is the key for a healthy person. Thank you, doctor, for your invaluable time and shares. There is another question. Doctor, can you throw light on the changes in approach towards lean PCOS and overweight or obese PCOS?
Yes, that's a very good question. See, actually, lean PCOS, we basically assess like what are the etiological factors. We ask them a lot of things. So if we see that it is somebody who follows a healthy lifestyle and still getting the problem, or somebody who has erratic lifestyle and getting the problem. So there are two categories actually. Some they have like excess calorie intake or erratic food habits. All that we get to know the exact cause, so we can advise them. Yes, once you correct your lifestyle, you will be relieved. So another category is there where they may be having a proper lifestyle. I mean, they may be eating from home, they may not be eating anything unhealthy, eating on time. And so there, like it's little dicey, like we find it little difficult to find what exactly is the cause. So how we categorize is that there are diseases which are considered as sandarpanotha and apadarpanotha, means something which is caused due to overnourishment or undernourishment. So lean PCO, generally what we have seen is they have this apadarpanaja etiology, means their agni may not be good, their metabolism may not be good. So we focus on giving nourishing treatments. So suppose if it is somebody with obesity, obese PCO, then first we try to reduce their weight, improve their metabolism, all that. But if it is a lean PCO who is coming to us, usually they'll be Vata Prakriti people, constitution will be Vata Prakriti. So we give them nourishing treatment. So we may start with them, for them, we may start directly with some ghee orally. Unlike, in the obese PCO where we may start with some kashayas, or the treatments we suggest for obese PCO may be something different, like Udvartana. For these lean PCO, we may suggest some treatments like Anuvasana Asti, like some oil enemas we may suggest. So it depends on that that differentiation, whether it is Sandarpanotha or Apadarpanotha. So if it is like a lean PCO, generally we focus on giving nourishing treatments, because what see, another important interesting thing is like this polycystic pattern, it is seen in patients who have regular cycles. Their cycles may be regular, but the follicle, in scanning, it may show polycystic ovaries. So my observation is that for those who have inadequate egg growth, if the egg growth is not proper, even that shows as polycystic pattern. And in those kind of people, actually, the ovarian size is not increased. The volume of the ovaries will be less. So basically, how I evaluate is that they have inadequate follicular growth, and we rectify that basically by giving nourishing things internally. It can be ghee or it can be leha, something nourishing. So that's how the differentiation comes. If it's obese PCO, we give on something which reduces all those. If it is lean PCO, then we focus on giving nourishing treatments. So that's the difference. So there we'll not touch on this prameha samprapti and all that. There we may consider some other things, for example, Rajakshma, something like that. So the consideration of disease pathogenesis will be entirely different, and the choice of medicines will be entirely different for lean PCO and obese PCO.
Thank you, ma'am. So there are a couple of questions I got in my WhatsApp as well. So you had mentioned that young girls with signs of PCOS in USG report need not be worried or need not come for treatment. But as doctors, we get a lot of such reports with a lot of patients who come in worried. What do we advise them?
Yes, so that's also something. Yes, we get a lot of such clinical situations. So what we have to look for is, like we said, it's 2 out of 3 criteria it should fulfill. See, if somebody is coming to us only with a scan report which says polycystic pattern of ovaries, if they have perfectly regular cycles, no change in flow pattern, for example, so for some initially they may come to us is like, my flow was good, but now the flow has reduced. Earlier it used to be 5 days, now it's 3 days. Or they may say, like earlier, I used to change more number of pads, but now that has come down. It has become scandy kind. So that is also a Pururupa, we say, like a premonitory sign that it may go into irregularity. So suppose it is only a accidental scan finding with no other features, like no hirsutism, no hyperandrogenism features, no irregularity in cycle, it need not be treated. Basically, you can just advise diet and lifestyle changes. It need not be given medicines. And adolescents, actually only polycystic ovaries is not a criteria, but in adolescent, if hirsutism comes, that should be addressed properly. If an adolescent is presenting with hirsutism and this acanthosis, like blackish discoloration over neck and all, then that has to be treated.
Yes, ma'am. So the next question I have is treatment of PCOS in Ayurveda, is it completely curable?
Yes, it is actually completely curable if you come to us at the right stage, because there have been many cases where the polycystic pattern of ovaries has been cleared in scans, but in many others the ovary volume will come down. So we said like it should be within 10 cc, volume should be less than 10 cc. That's a normal thing, but many come to us with very high ovarian volumes, like around 20 cc and all that. That comes down, and basically, you see, you don't have to focus on the scan finding. If they are getting regular cycles with normal flow, that is a success of treatment. If it was somebody who was getting cycles in 3 months, 6 months, 9 months, and if you are treating them and if they are getting cycles regularly, that means the ovulation is established. So that indicates success of treatment. And it can be completely cured if you're coming to Ayurveda at a very early stage, and if you're willing to follow all the lifestyle changes and the regimen which we advise, then it is correctable.
Thank you, ma'am. Another question which came up is, Doctor, can PCOS be considered as an avarana? For example, in case Pittavrita Kapha, when we go for kashayams like Varanadi, since it has Bhallataka, it may trigger the Pitta. Then how can we approach, ma'am?
See, PCOS avarana, yes, it is avarana samprapti. It is there in some conditions, not in all PCO cases. That's why I said, like in modern, they follow a common protocol, but the presentations of the patients will be different. As I said, like there can be lean, there can be obese. There may be people who get cycles in 2 months, and once they get the cycle, it may be scandy. For some people, it may be heavy. So we assess all this. So based on that, we arrive at a conclusion. Okay, whether avarana is associated or not, or I think this must be somebody who's related to Ayurveda. So generally we consider this Artha Kshaya in two ways. So one is
yes, ma'am. This question was put forward by a doctor.
Yes, that's very clear. Okay, so Vada Kabha Avarana. So Vada Kabha Avardapyam Artham Nashri. That is one thing. Then Vada Pittapyam Kshiyaderaja. So there are two pathologies. So if we see that if it is like Vada Kabaja, then it is definitely an Avarana pathology. Okay, and if it is like Vada Pittaja, then it is a different pathology. So Avarana, yes, it comes into play in some cases of PCOS, not all. So we have to treat it accordingly. Avarana definitely comes into play in some chronic cases of PCO, but not in the initial stages.
Yes, ma'am. Thank you. So I'll just repeat for all the participants here. The link for feedback is given already. I have already shared it, but again I have shared it for giving the feedbacks. Giving the feedback is necessary for getting your certificates. Certificates will be provided to you within a period of 24 hours. Next question I have is, what is the timeline needed for treatment?
See, that also, actually, if you have to, just one second, if you have to get one menstrual cycle, it takes a 3 months preparation in your body. It's not something which happens overnight. So if, in 1 month, if you have to get a regular cycle, a prior 3 months preparation happens in the body. Before 3 months itself, your eggs are recruited, then one grows, one ovulates. So minimum duration that we tell is like minimum 3 months, you have to follow the medicines properly. Okay, and depending on the chronicity of the condition, you may need medicines for 9 months or maybe 1 year. Usually, so usually up to 9 months we say, because 3 regular cycles means 3 ovulation cycles we consider. So generally, what I tell them is like minimum, if it's like a chronic case, means minimum 9 months. Definitely, it is needed. But it's not that like in 9 months we can completely cure. If it is very severe, you may need more time also. And whether the patient is taking the Pancharma treatments, Shodhana therapies, because if it's very advanced condition, then you will have to do Shodhana, means Pancharma treatment. So if that is delayed, if Pancharma treatment is delayed, then the time duration which it will take to get the PCO or the ovulation pattern corrected will be longer.
Sure, ma'am. There is another question, very interesting question actually. People who, in allopathy, people who go for treatments due to PCOS, the infertility which occurs, they say that by the end of the treatment, they might get unplanned twins. Is it true?
See, that is also an interesting question, because I said like they do ovulation induction. Okay, usually what will happen is in a normal cycle, only one egg is ovulating, usually, but there are rare chances that two eggs can release. But in ovulation induction, what is happening is they're stimulating multiple eggs, multiple number of follicles get stimulated. So you can have twins. So that is like, that is why twin pregnancies are more in artificial reproductive techniques. Even when you're doing IVF or something, also same thing, they stimulate, they give high stimulation to the ovaries and recruit multiple eggs from the ovaries. Okay, and so what will happen is, even when they do IVF also, they select three or four embryos, actually they do select and keep it apart, and 1 or 2 will be introduced into the uterus. So yes, twinning or multiple pregnant twinning is, yes, it is increase, the incidence is increased in artificial reproductive techniques because of the ovarian stimulation. And another danger, that is, it is very dangerous. See, if you go on taking these artificial reproductive techniques, since the ovaries are getting stimulated, another interesting thing is the number of eggs in the ovaries are fixed, like you have 10 fingers. number of eggs are fixed. So it is supposed to come like, one egg at a time, but you are stimulating like, multiple eggs, and basically you are losing the number of eggs in your ovaries. So you attain menopause at an early age. So those who undergo rigorous artificial reproductive techniques, they attain menopause at a very young age because their follicles get depleted. So yes, twinning will be more in such treatments.
Yes, ma'am. Another interesting question. What is the role of Uttaravasti in treating PCOS?
Yes, Uttaravasti, generally we do only in married females, because a gynec examination is indicated only in married ladies. And Uttaravasti is generally done when they desire fertility. Even if they don't desire fertility also, if they're sexually active, we can do Uttaravasti. If they're married, we will do Uttaravasti. So Uttaravasti, it does something which is done directly into the uterus. Okay, the medicine is introduced directly into the uterus. So, it's like, see, if you put oil in water, it will spill everywhere, right? So same way, it's an oil. Basically, we use oil-based medicines. So when you keep that, introduce that into the uterus, it spreads through the entire uterus, tubes and all that, and it will improve the blood circulation to the uterus, as well as it nourishes the ovaries, because there is a tube which is open into the pelvic cavity. So it can, act on the ovaries also, and it will improve the nourishment of the eggs. So it does a lot of things. Depends on the medicine that we use, because Uttaravasti is a procedure which is done for a lot of problems like tubal block, or low ovarian reserve, many conditions. It depends on the choice of drug, but it has a direct effect on the uterus and ovaries. And it another advantage is that it bypasses the hepatic pass. Only when you are taking, only some part of the medicines reach the target organs, but this you are doing directly. So you get better, like you can say like 100% effect on the medicine on that area.
Thank you, ma'am. That was an interesting answer as well to that interesting question. Right now, we come to the end of the questions that have been listed here. Anybody else have any questions? You can directly ask doctor.
Hello.
Yes, sir.
Hello,
sir. Just I want to say a very nice presentation. At the same time, just I want to ask one small. That is, where you have not mentioned the nasya in your treatment methods.
Yes.
Because we are using that nasya in the Pumsavana.
Mm-hmm.
So why not we try this in this PCOD also?
Actually, studies on nasya has been done in polycystic ovaries with Shatapushpa Taila. It was done. Nasya was done in polycystic ovaries. So, like as I said, like if the pathology is based on, like if you feel that the higher areas are affected, like the hypothalamic pituitary axis is affected, then yes, definitely nasya has a role. Nasya can be done.
Nasya can be done means, because nasya not as marsha nasya. Pratyamarsa nasya, why not suggest to the patients? Because I have tried this one to one of my patients, and it is, I think it is beneficial.
Okay, sir. So it was like along with other treatments, or like Pratyamarsa nasya separately after doing all Shodhana
Pratyamarsa along with other treatments you can proceed.
Treatments.
Just they can do it at their home.
Okay.
They need not come to our clinic and do it.
Sir, any particular choice
what
of
I have suggested? I suggested Dhanantaram 7.
7 hours.
It has got some effect, but not yet that scan. We have not taken next scan, but the patient is feeling better.
Okay.
So just you can include not Shatapushpa Thailam, it's alone. All even Baladailam, what is said in
Avarti Daila.
Not Sheerbala, I am saying.
Avarti, Baladaila, Avarti. Payada Baladailam. It is said in Vadiga Universe.
That Alashmi Nasanam Sudur, just one word is in that.
Yes.
It is said in Vada Chikitsa.
Yes, sir.
That also you can try.
Actually, Avarti Dailas, Baladaila Avarti we use in Vada dominant, Vadiga Universe generally we use. For Uttaravasti and all we are using. Nasya I have not so far not tried, but I will try that.
See, you have got the hospital and other facilities.
Yes.
People are not having such facilities. Small practitioners.
Mhm.
So you can try that because there will be many patients coming.
Yes, yes, sir.
You try and have a data
Yes.
for that.
Yes, sure. Thank you.
Okay. Thank you for your presentation.
Thank you, sir.
So that was our senior most physician as well as the medical superintendent, Dr. K.S.Varier. Thank you, sir, for your feedback on the treatment protocol for PCOS. I would like to ask if anybody else have any questions, any more questions with doctor. By the way, there has been another feedback written. Thanks for a good, informative and rationale based talk, Dr. Aswini.
Thank you so much.
Thank you, Dr. Aswini. It was a great session packed with lots of insights and information. The question and answer session was very interesting. This is another feedback. Anybody have any more questions? I think there are no more questions. I would like to ask our MD, Mr. T.V.S.Varier, to give a few words on today's session.
Dr. Ashwini, it was very good, very interesting, and you have scripted a lot of the reasons and why we should how PCOD can be controlled. And I think, like I had mentioned in the chat box, a very disciplined lifestyle for all. I think that's the best way to go ahead for a healthy life. Thank you so much for sparing your time for us. Thank you so much.
Thank you, sir. I would like to ask our Executive Director, Mr. K.S.Varier, to give a few words on today's session.
I was very excited to hear all those information about PCOS because I was working with this PhD student that I was talking about when she wanted to come and take a drug for her study, and she had a specific routine that she was going to follow, and she asked me for some drug, and the suggested drug was this Mehani, the anti-diabetic drug that we gave, and she published that paper. She had very good results and she published that paper, and I was very glad that I was also there in the presentation, PhD presentation that she did. So that was an experience. Excellent presentation, very clear elucidation of what the topic was, and I'm sure those who have come here would have taken a lot of insights in their as take-home points. They have definitely got something out of your elucidation. So thank you very much for being here and honoring us for your presence. Your post as a professor has been proven here by the way you discuss the topic with very kind of fluid presentation that was. So it was very exciting to listen to you. Thank you very much, Doctor.
Thank you so much, sir, for giving this opportunity, and I'm humbled by the words shared by all of you here.
There was quite a presence from the audience side, and I had a very good question answer session, which was packed with very interesting facts and very interesting questions as well as very interesting answers. I think we come to the end of this session. Before that, I would like to thank Mr. Vignesh from Quadriga for helping us through the all of our sessions, for running it smoothly and making it a success. Thank you, Vignesh, and thank you, Quadriga. With that, I think we come to the end of this session. Anybody else, would you like to ask questions to Dr. Aswini? One last chance. You can contact Dr. Aswini either for academic interests or for consultations at IAM Healthcare Center. Otherwise, if you want to add any details about your connectivity, how people can connect to you, you can do that, Dr. Aswini. You are on mute.
I will share my number in the chat box so that
Yes.
if anyone has any doubts or anything, you can contact me in that.
Yes.
Sure, ma'am. I want to add here that Ashtanga, K.S.Varier's Ashtanga Ayurvedics have very good results with certain medicines in PCOS as well as associated conditions. When there are uterine dysfunction, bleeding dysfunction issues as well, we have something called as clombin. We have medication, something called as Femnom, both in the form of syrup as well as capsules for the same for issues of PCOS, treating various conditions of PCOS. We do that along with certain other kashayas as well, or some treatment methodologies depending on the condition. We also get we have our own doctors who are specialized in treatment for infertility and PCOS, as well as we have people like Dr. Aswini to always advise us any time of the day when we call her and when we treat. I personally endorse this view because she has helped me multiple times in treating my patients as well. Thank you, Dr. Aswini, for being present here as well and taking your time off from your busy schedule and giving us such a wonderful talk. We would be sure to calling you again for other talks as well in the field of Prasuti and Streeroga on different other topics as well. I hope you would be able to come and give us more talks.
Sure, it would be my pleasure. Because I think I have been associated with this K.S.Varier Ashtanga Ayurvedics for quite a long time, and most of the products that you have told also, I think we have used together. This Clombin and other products which you have said we have used even earlier also, which gave very good results. And at least we know that it's authentic products. Many patent drugs, we don't know whether it's authentic or not. But in this case, we are certain that it's definitely authentic. So
it's
thank
because of
you
the
for
classical
that.
background that we are
Yes.
using for creating those products, formulating those products. People like K.S.Varier, who has put in 51 years of service, he suggests a product and then that product comes to of good use.
This that PhD study topic, I will that one drug sir had mentioned, no? So I'll start using that in my practice, wherever. Yes,
you can send her the paper also, Girish.
Yes, sir, we'll do that.
The paper we have published, they have published.
I'll do that. Sure, I'll give you the details, ma'am. So whoever who would like to get the phone number of Dr. Aswini, it is put in the chat box. So I think with that, we come to the end of this session. Thank you, everybody, for being present here, taking your time off on a Sunday, for making yet another successful webinar episode. We hope to find all of you again in the next upcoming episodes of our webinars, Ashtanga webinar series. Thank you all. Thank you from K.S.Varier Ashtanga Ayurvedics and personally from me. Thank you all for being present here. Thank you. So we come to the end of this session.
Thanks, sir.